indicative time limits. Jane Hunt.
Thank you very much, Mr Chairman, and it's a pleasure to serve under your chairmanship. I also congratulate the member for South West Bedfordshire on securing what is quite clearly a very popular topic. Please, can I also declare that I am still a Borough Councillor for Chalmers Borough Council, and I'll be referring to them, and I'm also the Chairman of the APPG for District Councils. I look to the Minister. As he can see, there are many friends on this side, but we do suffer some frustrations, and so I look to him for his advice and assistance, please. We have, in my view, two main frustrations within this. One, I think you can do something about quite clearly, and another that I think we need your help in tackling with Department for Health. So we have GP contracts and the health profile of that, and we also have planning law. And these two things, never the twain shall meet, it would seem, and I would like to be able to do something about that if possible. So what I'd like to be able to do is support development, support housing, where it's appropriate and needed, the size and the type that's required for the local area, and more importantly, to create local communities. 3,000 houses in one place is a village. It's not a housing estate. And so I'd like to be able to do something about actually creating communities with proper infrastructure. And also I'd like to support my GPs and my constituents. My GPs in the constituency, I've had many meetings with them over recent months, and they've worked incredibly hard, particularly over the time of COVID. But we do rely on talking about going to see our GP an awful lot, rather than going to see a medical professional in a medical centre, perhaps run by a GP. And so there's something I think that needs to be done there. Examples in my constituency are, well, I could talk about the village of Sileby that's grown hugely, or indeed Loughborough or Mount Sorrel, but I'll talk about Shepshed and West Loughborough. Shepshed is a town, but it's grown enormously by thousands and thousands of houses over recent years. And Garendon Estate, next door to it, right next door in West Loughborough, is due to have 3,000 houses due to be built. There are 2 GP surgeries in this whole area. And so it's just completely unsustainable, whatever those GP surgeries try to do. Now, I've talked to the CCG about it and the local health service, and everybody's very keen to do something, but there's a definite reluctance to do so because of the risk factor. And also, in my view, there is less incentive to actually run your own GP service as opposed to just working in one or being a locum. There's a lot of risk involved. And so there's something I think we ought to look at as well. And we need to take into account that cost and risk of initially either extending your GP surgery or indeed having a new GP surgery. But I refer to my Right Honourable friend for Chipping Barnet. The lack of a 5-year housing land supply is absolutely crippling my constituency. And we need to be able to stop indiscriminate development which lacks forward planning. Our planning staff in the constituency, in the council, work very hard in terms of local plans, looking forward to 2036 and delivering things. But when you don't have a 5-year land supply, it's impossible to be able to do anything about that. So their intentions are good, but in practice, we're not delivering. At least we're not delivering in Loughborough. Now, we talked about in the manifesto having infrastructure first, and we said we will work around planning rules so that the infrastructure, roads, schools and GP surgeries come before people move into new homes. And I do think that is something we absolutely must do. We've talked about it in the Housing Infrastructure Fund and so on, but that has not created the kind of atmosphere, the kind of momentum that we were expecting, I think, and I would like to see more from that. I agree with the member for South West Bedfordshire about the recommendation on the number of patients per GP, but I would also ask you to consider perhaps the age profile of those patients as well. Again, in Shepshed, it's an older profile of constituents who live in the area, and generally speaking, older patients need GP surgeries more. So we need cultural change, in my view, more towards going to a professional for health reasons, a medical centre, not necessarily seeing a face-to-face appointment of an actual GP, but perhaps a nurse or so on. We absolutely must stop the 5-year land supply. And also, if we could, I would like to look at feasibility studies and infrastructure being funded up front, either from the developer or through the fund, so that feasibility studies of GP surgeries also are then funded, not by GPs having to stump up the money first. Thank you very much.